Hi, I'm Taylor Reimer and I'm going to be doing an IM injection. So it's February 7th, 2021 at 20:30. First check, Jake Nursing, 312-654-987, 312-654-987, January 1st, 1960, January 1st, 1960, Dr. Skills Lab, Dr. Skills Lab. The patient has no known allergies, no known allergies. Diamond hydronate, 150 milligrams, 150 milligrams, IM, daily, it's 20:30 on February 7th, so I can give this dose, and there are two transcribers. I'm gonna grab diamond hydronate, 50 milligrams per ml, so I can get 150 milligrams. It says IM, and I'll check the expiry date. Now I'll check the drug monograph. For diamond hydronate, it's an antiemetic. The maximum single dose is 100 milligrams. This dose is 150 milligrams, so I would check with the physician to verify that they still want to give this dose, and they do, so I will give it. And this can be given IM according to the monograph. So I'll put this away. So the dose here is 150 milligrams, and at 50 milligrams per ml, I'm going to be giving 3 mLs. So I'm going to wash my hands, and I'm going to swab the top of the vial. For 30 seconds, I'm going to swab. Okay, that's 30 seconds. Now I'm going to grab my 3 ml syringe, my blunt fill needle, and my 22 gauge 1.5 inch injection needle. So first I'll attach my syringe to my blunt fill. And I'm going to inject 3 mLs of air into the vial. And I'll withdraw my medication. All right. So now I'll recap the blunt fill. And I'll make sure all the medication is out of the needle before I discard it in the sharps container. Now I'll attach my injection needle. And I'll get it to the 3 ml line so that I can see a bleb. Alright, so you can see here I have 3 milliliters of medication, and I'm going to make a label. For Jake Nursing. Diamond hydronate, dose 150 milligrams, volume 3 mLs at 50 milligrams per ml. It's February 7th, 2021 at 20:30, TRUMSN2. So this I would attach to my needle. This is the label. Alright. So now I'll do my second check. I have Jake Nursing, diamond hydronate, 150 milligrams, at 50 milligrams per ml, that's 3 mLs, and I have 3 mLs here. IM injection needle, daily, it's 20:30 on February 7th, so I can give this dose. I'm going to put this vial away and gather my supplies. And now I will go to the bedside. So I'm going to walk in the room and do an entrance safety check. Hi, I'm Taylor Reimer. I'm a student nurse. I'm going to be giving you your medication today. I'm going to look at your wristband. Can you please tell me your full name and date of birth? Okay, Jake Nursing, January 1st, 1960, January 1st, 1960. And do you have any allergies? No allergies? Okay, thank you. I'll do my third check now. Jake Nursing, diamond hydronate, 150 milligrams, 150 milligrams at 50 milligrams per ml, that's 3 mLs, and I have 3 mLs here. I have an IM injection needle. Daily, it's February 7th at 20:30, so I can give this dose. So now I'm going to wash my hands, and I'm going to landmark the site for the ventrogluteal muscle. So I'm going to put the palm of my hand on the greater trochanter, my thumb towards the groin, my index finger towards the iliac spine, and my middle finger towards the iliac crest, and I will give the injection in between these two fingers into the ventrogluteal muscle. So I'm going to wash my hands and don clean gloves. So Jake, this medication, diamond hydronate, is for your nausea related to your chemotherapy. You might experience side effects such as dizziness, headache, drowsiness, and weakness. So if you experience any of those, please let me know. Before giving this medication, I would take the patient's vital signs, assess their level of consciousness, and assess their nausea. Okay, so do I have your permission? Are you okay to take this medication? Yes, okay, so I've landmarked the site for the ventrogluteal muscle, and I'm going to swab the injection site for 30 seconds in a circular motion. Okay, 30 seconds, and I'll allow that to dry. So if this site requires me to aspirate for an IM injection, I would aspirate, but this site does not require aspiration for IM, so I will not aspirate on this injection. So I'm going to Z-track and inject, stabilize, let go of my Z-track and put a cotton ball on. I'm going to activate the safety mechanism of the needle and put it in the sharps container. I'm going to take off my gloves, put those in the garbage, and wash my hands. And I'm going to sign the MAR 2030 TRUMSN2. Okay, so I'm going to be monitoring for a resolution of the nausea. I'm also going to be monitoring if there's any decrease in LOC related to the side effects of this medication. I'm going to put the bed in the lowest position and the call bell within reach. And I'm going to do my exit safety check. Then I'm going to document the assessments that I did and the vital signs that I took. Thank you.